Hi, my name is Betsy Smith. I'm a certified genetic counselor at Benefis Cancer Institute. I've been working here since 2004. Genetic testing for breast cancer has changed a lot over time, and the two genes that most individuals are familiar with are called BRCA1 and BRCA2, and they are among the genes that we've done the most testing for over time. Currently, we recommend genetic testing if there's a suspicion for hereditary breast cancer in a family for at least about 13 genes that can influence hereditary breast cancer risk. And when there's ovarian cancer risk in a family as well, that gene list increases to at least about 19. So if genetic testing has been performed in a family that's suspicious for hereditary breast and ovarian cancer, and that prior testing has only included BRCA1 and BRCA2, current guidelines would recommend retesting the family for additional susceptibility genes. We typically encourage families that are suspicious for hereditary breast and ovarian cancer to be reassessed if original testing was negative every couple of years to review the family history, the test results that have already been done, and to determine whether or not any follow-up is necessary. There are a lot of different subtypes of breast cancer, and we have identified hereditary conditions in women with all different subtypes. However, if we look at one subtype at a time, the percentage of cases that are hereditary can certainly vary. As an example, there is a form of breast cancer called triple-negative breast cancer, where the cancer cells are negative for markers called estrogen receptors, progesterone receptors, and a growth factor called HER2. That type of breast cancer, the triple-negative subtype, has a higher percentage of cases that can be linked to hereditary conditions compared to some other breast cancer subtypes. If there is a hereditary cancer susceptibility gene that's identified in a family, individuals with that particular genetic risk factor may have a higher chance of getting breast cancer, but the genetic test alone can't necessarily predict exactly what kind of breast cancer may occur or at what time during a person's life the breast cancer may happen. But because of those increased risks, there may be more aggressive screening or prevention strategies that we can use to counteract the types of breast cancer that a woman may be susceptible for, or at least catch it early when we successfully treat it. Over time, as we've studied individuals with cancer, we have predicted that approximately 5 to 10% of individuals with cancer have an underlying genetic mutation in a high-risk gene, what we would call a hereditary cancer syndrome. Now, that average is based on all different subtypes of cancer, and if we look at individual kinds, the statistics can be lower for some and higher for others. At this point in time, we routinely recommend genetic testing for all individuals with certain types of cancer, and that can include pancreatic cancer cases, high-grade or metastatic prostate cancer, all individuals diagnosed with male breast cancer, as well as individuals with ovarian cancer that's an epithelial type arising from the outside of the ovary or in the fallopian tubes, and a few other more rare subtypes of cancer as well. And more recently, genetic testing has been recommended in almost all individuals diagnosed with colon cancer, or it should be at least a consideration for those individuals as well. We also have genetic testing available for some subtypes of thyroid cancer and kidney cancer and many other cancer conditions. Men definitely can get breast cancer. However, a breast cancer diagnosis in a man is far more rare than it is in a woman. Currently, only about 1 of every 1,000 men will develop breast cancer, compared to about 1 out of every 8 women. When we see breast cancer in a man, it should automatically trigger a referral to a genetic consultation and genetic testing. Estimates have ranged from between 4 to 40% of male breast cancer has an underlying hereditary cause. We typically estimate that that's probably closer into the 20 and 25% range when we identify the general population with male breast cancer. The hereditary cancer genes that we have the ability to test for are inherited and passed on by men and women equally. So sometimes people have been misled to think that the family history on their father's side doesn't matter, or if a woman has sons, that her genetic status may not be important. What we know now is that those same genes that can influence breast cancer in women can also sometimes increase the risk for breast cancer in men, and may increase the risk for things like prostate cancer that would have implications regarding cancer screening and prevention strategies in the men in the family as well. If an individual is concerned that they may have a hereditary cancer syndrome in themselves or their family, we typically recommend that there is a genetic consultation to review that diagnosis and family history, to discuss the likelihood of the cancers being hereditary, and to identify not only the most appropriate test, but also potentially the most informative individual in the family to get genetic testing, and then to be able to interpret those test results. Once we order a hereditary cancer test, currently it usually takes about 2 to 3 weeks to get test results. Health insurance companies today currently only cover genetic testing for hereditary cancer syndromes in individuals that they would consider medically necessary or medically indicated. And that's typically determined by the number of cancers in the family and the types of cancer and the ages of onset. So if there's been no cancer in a family, typically most insurance companies will not cover genetic testing. However, even a single case of certain types of cancer may warrant genetic testing. So there's a lot of variability. For individuals who are concerned about genetic testing and may not meet testing criteria by their insurance company for coverage, there may be still affordable genetic testing options that are still medically and clinically relevant and may be affordable if individuals are interested. The goal of doing genetic testing for hereditary cancer syndromes can vary depending on the situation that the patient is in who's undergoing genetic testing. For somebody who's already been diagnosed with cancer, genetic information in some cases can actually help us to treat it more effectively, or can help us after we treat that diagnosis to determine whether an individual has a higher risk for additional cancers that we can intervene with through screening or prevention strategies to either prevent or catch at their earliest and most treatable stages. For families with hereditary cancer syndromes, genetic testing can help identify which family members inherited that particular hereditary risk factors and which did not, so that we can tailor those screening and prevention strategies on a case-by-case basis. Having a genetic susceptibility doesn't necessarily mean that a person will develop cancer, but there's an increased possibility of certain cancers developing, and having that information can be very helpful in medical management to be proactive in healthcare and to live a long and healthy life. Thanks for your questions today. I know that probably some of you have additional questions about genetics of breast cancer or other cancers, and I'd be happy to sit down with you one-on-one to discuss those on an individual basis if you're interested. Genetic counseling is provided at the Benefis Cancer Institute on Monday through Friday. If you're interested in an appointment or want more information, please call us at 406-731-8200. Thanks.